Bank of America just confirms that women's health is one of the most mispriced markets in the global economy. Close the gap and you unlock $1 trillion in GDP. But here's what the report reveals that most people aren't talking about. This market is investable but only partially legible to capital. Women's health gets just 6% of total healthcare investment, and nearly 90% of that is concentrated in just three areas: reproductive, maternal, and cancer. That's not a diversified market. That's capital flowing to the most familiar categories, not the biggest opportunities, which means the majority of women's health is still structurally invisible to investors. Not because the opportunity isn't there, but because the infrastructure to see it doesn't exist yet. So, where is the real upside? Three places the report flags that capital hasn't reached yet: data and analytics, diagnostic and early detection, preventative care models built around how women's bodies actually work, not male default assumptions retrofitted for women. And this is where AI becomes a genuine force multiplier, not just improving care delivery, but making the invisible categories legible to capital for the very first time. When you can measure it, you can fund it. When you can fund it, you can build it. Here's the bottom line the Bank of America report is really saying, even if it doesn't say it plainly. Women's health isn't underfunded because investors don't care. It's underfunded because the market infrastructure to evaluate it, price it, and deploy capital into it barely exists. The next wave of winners, they'll build the infrastructure that the entire women's health market runs on. Women's health isn't underfunded, it's underbuilt. And that's the fine print Bank of America is pointing to.